What if your Medicare coverage was chosen for you without you even realizing it? There's a new proposal that could make Medicare Advantage plans the default enrollment option when you're eligible for Medicare. And this could impact your doctors, your prescriptions, and even your wallet. Hi, I'm Erika Smiley with MedicareSchool.com, and in this video, I want to talk about what this change could mean, who benefits, who loses out, and why this could cost taxpayers billions. Even though the President's administration has said that there'll be no cuts to Medicare benefits, there are some policymakers who would really like to boost the amount that we're using Medicare Advantage plans. They're even talking about possibly making it the default enrollment option when people become Medicare eligible. So in this video, we want to take a look at this, and here's the things that we're going to cover. So first, we'll look at the proposed policy change. We'll look at what Medicare is now. So right now, traditional Medicare, you get enrolled in A and B, and then you have two options of either a supplemental plan with Part D or an Advantage route. Then we'll look at this default enrollment system. What are the pros and the cons of this? And really, what would this cost the government? But most importantly, what would this cost you? And is this even possible? So first off, let's look at exactly what Medicare Advantage plans are and some of the things people like about them and some of the things people may not be so crazy about. Let's look at the pros and cons here. So first of all, a lot of people really like and see it as a benefit that many of those Medicare Advantage plans have a very, very low monthly premium or they're $0 premium. So a lot of times they're $0 a month, even though you do have to pay for things like co-pays, deductibles, a max out of pocket, you don't pay a monthly premium for an Advantage plan. People also really like the perks, okay? So these do have things included such as a dental benefit, vision and hearing benefits. A lot of them even have a gym or a wellness benefit. You may have heard of silver sneakers. It includes all of this and you get your gym membership paid for. Now the other one, you've heard of Part D, okay? You have to have a drug plan. So with the Advantage plans, the drug plan is wrapped in that Advantage plan. It usually comes included. So your prescription coverage is with the Advantage plan. Now some of the cons are things like networks, okay? So original Medicare, you can go to any doctor that accepts Medicare. That's about 98% of doctors in the country. But with an Advantage plan, it works more like your traditional HMO, PPO, where you have networks. These are local networks. And if you go to the doctor, you really need to make sure that doctor is in network, because if you go out of network, it's either not going to be covered at all or you're going to pay a much higher copay, okay? So that can be a downfall. Also referrals, okay? That's a big one. Referral pretty much means if you want to go to a specialist, let's say you want to see a cardiologist, or orthopedic doctor, you have to go through your primary care physician to schedule that appointment. You can't go directly to that specialist and get the appointment. So referrals are something you need to think about with Advantage plans. The other things, it's called a prior authorization, okay? So that just means if you do need a surgery or a procedure, the doctor says, hey, you need to go have a hip surgery, you need a hip replacement, you can't just schedule that. You have to make sure that the insurance company is going to approve it. They may say, you know, we'd like for this person to try physical therapy first or something like that. So prior authorizations, they can cause some red tape when it comes to your health care. So these are kind of some pros and cons of what Advantage plans are. Now keep in mind, currently with the system, the way it works is you can enroll in Medicare A and B, and then you have two options of what to supplement and fill those Medicare gaps with. All right, currently in the United States, when you turn 65, you're eligible to enroll into Medicare Part A and Part B. So as a reminder, if you've worked 40 quarters and paid 10 years into the system, you're gonna get Part A for $0. So there's $0 premium for Part A, and that's your hospitalization and your inpatient coverage. Now Part B for the average American is going to be $185 per month this year. That's the premium monthly for Part B. So you get enrolled in Medicare A and B, and if you've seen any of our other videos, we talk a lot about Medicare gaps. So Medicare doesn't cover everything. A lot of people don't know that. It only pays 80%, and there's a lot of gaps that you have in original Medicare. So you have two options of how you can fill those gaps. And what people do today is after they enroll in Medicare A and B, have to have A and B for both of these options. First, you can go with a supplemental plan, which is also called a Medigap plan. So you might have heard this referred to as Medigap, supplemental, Medigap. Those are really interchangeable terms. So you get that supplemental plan, and then you add a standalone Part D prescription plan as well to cover your medications. Now, the other option is you enroll in A and B, and this is somewhat, we call it replaced by a Medicare Advantage plan, because now instead of the government managing it, it's managed by private insurance companies. So this Advantage plan, usually it has the drug Part D plan encased in it. So it's wrapped in this package, so it's just one thing, the Medical Advantage plan. So this is the idea, the people who are proposing this, that instead of people enrolling in traditional Part A and Part B Medicare, when you turn 65, you can be auto-enrolled into this Medicare Advantage plan. So you might be wondering, what are most people doing right now? Are they going with option one, the supplemental and Medigap plan, or are they going the Medicare Advantage route? So let's kind of take a look at some numbers. In 2024, 67 million Americans enrolled in Medicare, and out of those, about 34 million went the Medicare Advantage route, okay? So about half. 2025, we're on pace for the same thing. About right now, 51% of people, a little over half, are going the Medicare Advantage route, okay? So this default enrollment idea is really nothing new. They've tried default enrollment with other things like retirement saving plans, organ donation, even electricity pricing plans. And what they've found is people kind of tend to go with the flow. When they're automatically enrolled in something, they see that most people just stay with the plan they're automatically enrolled with, right? It's easy. You're on this plan, we've put you on this plan. But here's the thing, right now you have the two choices of, okay, do you want to do traditional Medicare and a supplemental plan, or do you want to go the Advantage route? But here's another thing to think about. People who are going with Medicare Advantage plans, they've made that decision, but right now the average American has 34 different Advantage plans with that prescription drug coverage wrapped in it that they have to choose from. So it's not like even if you choose the Advantage route, we just say, okay, here's your Advantage plan. You actually work with a guide, like one of our guides or an agent. They talk to you about who your doctors are, what medications you're on, and you have a lot of different carriers to choose from. So that's the big question mark here. If they made this automatic deferred enrollment, how are they going to choose the plan that's best for you? So let's look at some of the benefits and some of the issues that could be possible with this default enrollment system, okay? So first of all, the benefits, this could help people with less missed deadlines. So there's a couple different times that you can come into Medicare, and there's a lot of rules around it. You have to do things at a certain time of year. So there's the IEP, and the IEP is the initial enrollment period. That's when people are turning 65. It's a 7-month window around your birthday month. So let's say your birthday's in July, you have 3 months before and 3 months after that you can enroll in Medicare. Now, if somebody misses this, they could face penalties. They could have to wait until the next general enrollment period. So an enrollment system like this, that's a default enrollment system, we wouldn't have to worry as much about people missing these time frames and these windows where they can enroll in Medicare. The other one is called an SEP. So if you're not coming into Medicare when you turn 65, you're probably coming in after 65 when you're going to be retiring and losing your employer coverage. So again, this is a thing where you have to, unless you're enrolled in Social Security benefits, if you're taking Social Security benefits, you're automatically enrolled in Medicare. Okay, but if you're not taking Social Security benefits and you retire, let's say you're 67 years old, you have to go fill out 2 forms. One's called an L564. Your employer has to sign it. The other one's called a CMS 40B, and you have to turn those forms in and you have to enroll in Medicare. So this leaves some room for error. If people miss these enrollment periods, that is problematic. So a default enrollment system could be good because we'd have less people missing these deadlines, okay? Now more people would have comprehensive coverage. So we talked about original Medicare, parts A and B, and there's a lot of gaps. Actually, one of the worst things you can do is stay with just original Medicare. That leaves you very financially vulnerable and at risk with all of those gaps. So at least if you were auto-enrolled in an Advantage plan, you would be getting some kind of comprehensive coverage that's going to be much better than original Medicare itself, okay? And really, the last benefit would be those added perks. So traditional Medicare A and B doesn't have any of the benefits like the dental, the vision, the hearing, the wellness benefit. And remember, again, these Advantage plans, most of them have that drug coverage encased in the Advantage plan. So those are some of the benefits. So let's look at the downside. What could some issues be with this? Well, first of all, it could be provider access, okay? So you like to go to the doctors you like to go to, right? Some of us have gone to the same doctor for years, a really long time. When you're enrolled in an Advantage plan, you have to worry about networks. So maybe your favorite cardiologist or your OBGYN is not part of that network. So it could limit doctor access. Now, another thing to think about here is more and more doctors are saying, we're not going to accept Advantage plans. They don't want insurance companies telling them how to treat their patients. So there's already a little bit of tension between some doctors and accepting Advantage plans. And if we made this an auto-enrollment where people are automatically put in Advantage plans, that would drive up the number of Advantage plans, and that may cause further tension between physicians and Advantage plans, and again, just mess up your access as a patient to who you can go see. Now, another issue could be drug coverage. Now, we did talk about how the Part D, the drug, is part of the Advantage plan. So you're thinking, hey, Erika, why would that mess up my drug coverage? Well, here's the thing. Right now, if someone calls our guides, we talk to that person and we ask them, what medications are you on? Give me a list of your medications. Tell me what dose you're on. How many times a day do you take that? Because we want to make sure we match you with the Advantage plan that's going to have the correct formulary that's going to cover your drugs. So I don't know how this would work, but a default enrollment, if you're just assigned an Advantage plan, who knows if the government's going to pick the plan where your drugs are covered. So we don't know what that would look like, if your medication would be on the formulary or not on the formulary. Then we would kind of lose the freedom of choice. So, obviously the freedom of choice, if you want to be enrolled in that or not, because it would be default, you'd have to opt out of it after they enrolled you, but also the freedom of choice of carriers. So there's a lot of different carriers that have these Advantage plans, and right now people get to choose what carrier they'd like to use. Usually people go with, the best plan, right? What has the lowest max out of pocket, or what's the best match for my doctors and my drugs? But sometimes people just have a preference of carriers. Maybe they love Aetna or they love Cigna. Their employer plan was through Cigna and they used them for years. So right now people do have kind of a preference sometime of what company they'd like to work with. And if we had a default enrollment system, that may take away that freedom of choice. Prior authorizations. So more Advantage plans would be more of those prior authorizations. That can just cause red tape. It can kind of cause things to get denied. Can be kind of a headache. Now also, with this default enrollment, would they look at special populations? So there are some people who are on disability. They can get set up on special plans. There's also people who are what we call dual eligible. They're eligible for both Medicare and Medicaid. And now these people can get plans called D-SNP plans. So really, would they be looking at the special populations like those people when they're auto-enrolling them into one of these plans? And lastly, just what are the financial implications to you? So as I said before, there's 34 different Advantage plans that the average American can choose from right now. And these all have different kind of price points. Now, usually the monthly premium is $0, but they have different co-pays. They have different deductibles. They have a different max out of pocket. Some of the max out of pockets I've seen are as low as $3,500 in a year. Some can get upwards of $8,000 to $10,000 in a year. So really, if you're just put on a plan, is that going to be the best financial plan for you? Hey, if you found this video helpful, do us a favor. Go give us a like. We always appreciate it. And subscribe so you don't miss out on any of those future videos. And leave us a comment. We'd love to hear what you have to say. We love to answer any questions you have. That's what it's here for. So drop us a comment below. The Center for Medicare and Medicaid Innovation has statutory regulations that state that if there's going to be any changes made to a model, first of all, it has to improve the quality of care without driving up prices. So let's look at, is this even possible? Is this something they could really do, this default enrollment? Well, first of all, they would have to make sure it didn't increase cost, right? Because that would go against. We want to improve quality of care without increasing cost. So they would have to try and do this in a way where it wouldn't significantly drive up cost. Also, it would have to be tested. So either regionally or nationally, they would have to find a way to test this model before they truly rolled it out full steam. Also, we'd have to look at who would this apply to, okay? So again, is this going to be everyone who turns 65? Is this going to include people who are retiring and coming into Medicare at 67, 68, 69? Is it going to include special populations of people? So really, they would have to state who is this going to apply to. And then they would somehow have to come up with a way of having very transparent and fair plan selection. How are they going to choose what Medicare Advantage plan is directly assigned to you? Are they going to put it out to the different carriers to bid on who's going to get different states or different areas? So it would have to be fair. They would have to come up with a way with the plan selection and how they're going to do that. And lastly, really the communication. They would have to think about how are we going to communicate this with people and let them know? How is the opt-out going to be offered if they don't want to stick with this Advantage plan? So a lot of things to look at of if this could really be an option and something that could truly happen. So currently it's found that the government is paying 20% more for each beneficiary to cover them on a Medicare Advantage plan already. And this is going to result in over $84 billion in excess spending in 2025. So that's going to bring the total federal payments into Medicare Advantage plans this year, just for 2025, between $500 and $600 billion. So really, what could this default enrollment do to cost for the government? It's projected over 10 years, this could increase the government's cost to cover the beneficiaries anywhere between $189 billion to $269 billion. That's a lot of money for taxpayers to pay into having people covered through Medicare Advantage plans. Now, for you, what would this mean for your cost? Right now, that Part B deductible, remember when you enroll in Medicare, Part A is usually $0. Part B premium costs you $185 right now. If we look back in 2020, that Part B premium was only $144.60. So it has gone up almost every year. But if we had this default enrollment system and all this money from the government's being poured in there, that could cause even more hikes to your Part B premium. So the good news is for now, you still have the freedom and the option to choose what you'd like to do. So remember that traditional Medicare, Part A, you're going to get that for $0 probably if you've worked 40 quarters and paid into the system. Part B right now is $185 for the average American, okay? So you have the option still. Which direction would you like to go? You can enroll in traditional Medicare and add that supplement plan, also known as the Medigap plan, with the Part D prescription coverage, or you can go the Medicare Advantage route, okay? And it's not that one way or the other is right or wrong. It's really what's most important to you in your coverage and what plan is going to be the best fit for you. Now remember, these work a little bit differently. A lot of people do like the supplemental plans. Those plans you might have heard, Plan G or Plan N. Those are some of the most popular supplemental plans right now because it gives you a little bit more financial predictability. Yes, you do pay a monthly premium for these. You pay anywhere between, on average, $150 to $180 per month to have this supplemental plan. But if you're on a G plan, no matter what happens to you that year, you could medically have the worst year ever, multiple hospitalizations, surgeries. No matter what happens, after you pay that monthly premium, the only thing you're responsible for is that once a year Part B deductible, which is $257. So I can tell you, my parents, they have been in and out of the hospital over the years. They've had so many health issues. And nobody knows. We don't have a crystal ball. Right now, you might be 64 years old and watching this and healthy, but you don't know what's going to happen when you're 70 or 80 years old. So a lot of people like the predictability of those supplemental plans because they know, yes, I'm going to pay this monthly premium, but if something happens, God forbid, I have a $200,000 bill, I know I'm covered and I'm only paying $257, okay? And then again, we add the Part D to that. Those can range anywhere from $0 a month to up to $100 a month. It really depends on what medications you're on, if you're on those basic Tier 1 and Tier 2 medications, or if you're on one of the more expensive medications. But that's what we're here for at Medicare School. Give us a call, talk to one of our guides. We're happy to walk you through and understand all your options and make sure you pick the plan that's going to be best for you.